This mini didactic is part of our best in class measures for 2026. So I'm going to focus on discussing alcohol use and screening for at-risk drinking and as well as alcohol use disorder. Alcohol is a commonly used substance in the United States, and while it's socially acceptable, it carries significant health risks and sometimes use can become harmful. I think that's why it's such an important area to address in the occupational health world. I know these conversations with patients can sometimes feel tricky or uncomfortable, so I'm going to spend a few minutes giving some background on the issue, explaining why we're using the audit C for screening, and walk through what to do when a patient screens positive. And by the end of this training, you should feel more confident about both the why and the how of this measure. The metric specifically is documentation of the Audit C questionnaire for all post-offer examinations and new injury exams for adults 18 years of age and older. Screening for alcohol use is an evidence-based practice. It aligns with the NCQA HEDIS measures, or the National Committee for Quality Assurance, the Healthcare Effectiveness Data and Information Set, and it carries a Grade B recommendation from the U.S. Preventive Services Task Force. Alcohol is the most commonly used substance in the U.S., and at-risk drinking is estimated about 30% of patients in a primary care clinic. That makes screening both necessary and important. Alcohol use disorder is also very common. Patients with alcohol use disorder face a higher risk of death from all causes on average, and risks include motor vehicle crashes, accidents, intentional and unintentional injuries, and a range of social and legal challenges. Alcohol also impacts almost every organ system, from the brain to the GI tract to the cardiovascular system. So audit is part of the SBIRT approach. Many people in primary care are familiar with SBIRTs. They stand for screening, brief intervention, and referral to treatment. Our targets this year, minimum target will be 75% of charts with a documented audit C. The threshold target will be 85%. The target will be 90%, and the maximum will be 95%. I think it's important to also note here that patients should always be reassured that their screening results are considered confidential and will never be shared with their employer. Audit C stands for Alcohol Use Disorder Identification Test, and the C stands for consumption. The audit was developed by the World Health Organization and is a set of questions. It contains 10 items using 3 domains. The audit C, or consumption, emerged as a practical, streamlined version of the larger survey that proved especially useful in the primary care setting. So there are 3 questions to the audit C. Number 1, how often do you have a drink containing alcohol? Number 2, how many drinks containing alcohol do you have on a typical day when you are drinking? And number 3, how often do you have 6 or more drinks on one occasion? And then the answers to those have various scores associated with them. The maximum score for the audit C is 12. A score of 4 or more identifies 86% of men who are drinking above recommended levels or who have alcohol use disorder. And a score of 3 or more identifies 84% of women who drink above recommended levels or have alcohol use disorder. So when the result is 4 or more for men or 3 or more for women, the result is considered high. Now, what do we do with this result? This is a handout entitled Understanding At-Risk Drinking that can be given to patients. It gives some definitions specifically for drinking limits for both men and women, and also binge drinking. It gives information about what is considered a standard drink. Gives some context about why this matters and what can be done about at-risk drinking. It gives some signs also about when your drinking might be of concern. And then at the bottom, it gives patients resources, one from the Substance Abuse and Mental Health Services Administration helpline, gives the Alcohol Anonymous website, and it also has a QR code which takes you to findtreatment.gov so you can find a provider who provides substance use treatment. The BI in SBIRT stands for brief intervention, and the Audit C questionnaire and the handout really are meant to start a conversation with the patient about drinking, about at-risk drinking, and about when to seek help. And I have found this mnemonic to help structure that conversation around alcohol to be quite helpful. So the mnemonic is called FRAMES, and it stands for feedback, responsibility, advice, menu of options, empathetic counseling, and self-efficacy. So a conversation would go something like, sir, your audit C was found to be high. You, of course, make the decision, but as your doctor, I recommend cutting back or stopping entirely. And then depending on the response, there's lots of ways to reduce your drinking, including setting personal drinking limits or having regular alcohol-free days. Change is really hard, but I think you can do it. Even small steps can make a big difference. So how do we know if someone has alcohol use disorder? So this slide outlines the DSM-5 criteria for alcohol use disorder using the mnemonic chew that cop. Let's go through it now. C stands for cut down. The person has tried to cut down or stop drinking but hasn't been successful. H, health. Their drinking is causing physical or mental health problems, but they keep drinking anyway. E, excessive use. They're drinking more or for longer than they intended. W, withdrawal. When they stop, they experience withdrawal symptoms or use alcohol to avoid them. T, time. A lot of time is spent obtaining, using, or recovering from alcohol. H, hazardous use. Drinking in situations that are unsafe, like driving. A, activities. Important social, work, or recreational activities are reduced or given up. T, tolerance. They need more alcohol to get the same effect. C, craving. Strong urges or desires to drink. O, obligations. Failing to meet obligations at work, home, or school. P, personal problems. Continuing to drink despite relationship or social problems caused by alcohol. A patient meets the diagnosis if they endorse at least 2 of these criteria within the past 12 months, and the severity of alcohol use disorder is based on how many criteria are present. So mild alcohol use disorder, 2 to 3 criteria, moderate, 4 to 5 criteria, and severe, 6 or more criteria. So what is the treatment for alcohol use disorder? Treatment includes both acute and chronic settings. In the acute setting, we primarily deal with intoxication and withdrawal management. And in the chronic setting, we're looking at abstinence initiation, use reduction, and relapse prevention. There are many forms of psychosocial treatment, including formal therapy, self-help groups like 12-step programs, most famously AA, but there's also smart recovery, rescue recovery. There's lots and lots more, and each have varying levels of evidence and should be tailored to patient preferences. There is pharmacologic management of alcohol use disorder. It is underutilized in the primary care setting. There are 3 FDA-approved medications, and they include naltrexone, acamprosate, and disulfiram. And only about 8% of adults with alcohol use disorder in the US are treated with medications. There's lots of medications with varying degrees of evidence used off-label, including topiramate, baclofen, gabapentin, ondansetron, sertraline, and many more. And interestingly, the audit C, we talked about it being high or not high, but the degree to which your audit C is elevated may help you select an intervention for someone. So an Audit C score of 4 or more, 4 or 5 would mean moderate risk drinking, and you might just do a brief intervention. 6 or 7 is a higher risk drinking. You might do brief intervention, talk about medications, or talk about sending to a specialist. 8 or 9, severe drinking, start medications, psychosocial intervention, and definitely refer to a specialist. And then 10 to 12, specialist management and likely referral to inpatient treatment. We will not be prescribing any of these medications or doing formal referrals at Barnes Care. However, I think it's important that you have a good understanding of the treatments that are available. Here are some resources that I used in this presentation. If you would like more information about alcohol use disorder, I recommend these sources. Thank you.